Governor. Good afternoon. Can you clarify about the testing? You talked a week ago about bringing on two companies, a Rhode Island company, and I've gotten a deluge of emails and calls from people who say that the picture that you've painted is not as rosy in terms of being able to get them back. Now, part of the problem is I heard from two people who are trying to visit relatives or loved ones or friends in hospitals in Massachusetts. So there's the Massachusetts barrier, and they're trying to jump through hoops. It's days out and whatever. So can you clarify if somebody needs to get a test? Somebody told me that if they're asymptomatic, it's almost impossible. So they have to kind of fake a cough or say, I may not be feeling well to get the test. Can you talk about the reality versus some of what we've heard about, you know, it's getting better. You acknowledge with schools that you're facing a challenge.
Yeah. So, let me say, I'll say where we are right now, where we were, where we are, where we want to go. Right now, the delays are too long. You know, I'll be the first to say that. You should be able to get a test. So you should, if you're asymptomatic, and I've heard from a lot of people just who I know who quickly get a test. If you go to the portal.ri.gov, you should be able to schedule a test pretty easily. If you feel sick, you should call your doctor, and you should be able to pretty quickly be able to schedule a test.
I've heard from some people days out. They call, they go on the portal, they try to get it, and they said, well, we can get you in Friday or Sunday.
Yeah, that could be true. And then the even bigger problem, which is what we're working on, is when you get your test, I want you to have your result in 2-3 days. 2 weeks ago, we were at 7 days. Now we're down to average. Now we're down to 4. I got to get it down to 2 to 3. So I would say if you're sick, you know, if you needed a result immediately, we have a testing operation at the convention center. You tell your doctor you're sick. The state health lab can turn it around in a day. Rhode Island Hospital can turn it around in a day. Otherwise, it is inconvenient now for a lot of people. This week we started with Dominion Diagnostics. That's 2,000 tests a day additional, 48-hour turnaround. 3 weeks from now, that's going to be triple that. So I would say it is inconvenient, and 3 weeks from now, I hope it'll be a lot better.
Just one more question. Have you also talked to your friend Governor Baker? Because Massachusetts, now we see Governor Cuomo saying, you know, it's fine, Rhode Island going down to New York and Connecticut and New Jersey. Massachusetts is still a big problem, and the numbers do not seem to be that disparate. Have you had that conversation with him about loosen up a little bit, Charlie?
I sure have. And he says, look, the rules are the rules, which I respect. You know, every governor has their hands full right now, big time. And he says, the rules are the rules. And so I hear that, I respect that. I will tell you this about our testing team. They hustled like crazy last week. A lot of people were going to Martha's Vineyard or Nantucket over the weekend. They did like 700 tests in a day on Friday with rapid turnaround so people could go away on vacation. So the testing team is hustling. We're not where we need to be. I'm not going to pretend that we are. Here's why. It's like a fight for resources. The commercial labs are totally overfull. The wait time at commercial labs is too long. We're struggling to get testing kits. Over the weekend, I'm on the phone with CEOs of Roche and of these companies saying, fill our testing kit orders. So it's the same constant struggle for resources. So that's why we said we want to do it all in state. We're going to Dominion, we have supply. Like I already said, we're at 2,000 tests a day now, guaranteed in our backyard, two-day turnaround. A few weeks from now, I think will be a lot better.
Governor, on the school busing
executive order.
Go ahead.
Donald Trump issued an executive order this weekend seeking to have the federal government dictate the renewal of the extra unemployment benefits. Of course, as you know, calling for a $400 a week, the fine print being that it would be a $100 per week contribution per laid-off employee. Given the money involved, and also given Rhode Island's challenges with having a streamlined unemployment delivery system, this would require a new one. Has the federal government been in touch with you at all about this, and are there any plans to move forward with this?
Yeah, it's a good question, good question. No, they have not been in touch. This is like a smoke and mirrors approach by the president. There is no question we have tens of thousands of Rhode Islanders struggling. How are they going to pay the rent? You know, they're relying upon that to survive. Tens of millions of Americans. We need the federal government to do its job, Congress to pass a law, the president to sign it, and renew unemployment insurance. He summarily suggested that governors, he'll kick in $300 without telling us where the money would come from, how we should administer it, what the parameters would be. It's, you know, has no authority from Congress to do it if the states kick in $100. I haven't found a governor in America who has said they're going to be able to administer this program. Republicans and Democrats are saying, what is this? It's an intention. By the way, I support the intention. But then Congress needs to pass a law. They need to send the states the money, just like last time. And we will, obviously, quickly implement it. Rhode Island was the first state in the country to get our pandemic unemployment assistance checks out. I'll be the first governor in America to get those checks out. But the president has to give us a serious solution. He can't just write on a piece of paper, I'll give you $300 if you kick in 100. Good luck.
Is this, I know you've tried to refrain from politics, but is there a way of addressing whether or not this was just pure politics?
I don't know. I don't know. I just want to help. Like, it is the middle of August. We don't have a budget. Unemployment insurance is, you know, what's happening. It hasn't been renewed. This is real. People are going to get evicted, can't pay the bills. Children are going hungry. I don't want to speculate as to his motives. It's wrong, it's immoral, it's incompetent, it's not solving our problems. So give us a serious solution, and I'll be the first one to implement it.
Governor, can we get back to the schools just for a moment? You're saying September 14th, 2-week delay.
Yeah.
On that day, does everybody go back in person?
It depends if they meet the metrics. So there's 5 metrics. The state has to be in phase 3. I think we'll check that box. That town has to have 100 cases per 100,000 or fewer. The testing has to be where it is. It has to be where we said it is, and the school has to be ready. If it hits those 5 checks, yes, they should go back in person. If it doesn't, like right now, for example, today, if we made that decision, Central Falls and Pawtucket couldn't go back fully in person. Neither could Providence, because they're above 100 cases per 100,000.
If those schools, hold on, Mark. Those districts, why aren't they going back distance learning on August 31st?
Because we
You had
decided.
announced in June they'd go back.
Yeah.
They've had plenty of time.
Yeah.
They're not going back, but why can't they start school that day?
Listen, this is an excellent question, and we grappled with that. They're just not ready. You say they've had plenty of time. It might be harder than you realize. They're just not ready.
Right. Let me ask
And
you
I
this.
think they will be ready if we give them a couple more weeks.
Massachusetts is doing, have you seen a 4-color code
Yeah.
system, right? Now, the community that I live in, the cases are less than 5. 89% of the parents want the kids back in school
Good.
5 days a week.
Then they
So,
should be.
but then why aren't they going back? What, for instance,
I don't know
is the
either.
state going to
They
treat it
should
that
be.
everybody's the same? Is the state going to treat it that, for instance, if there are some school districts that are ready to go back the 31st in certain communities, since they
see.
submitted plans
No.
to you, why
Okay.
can't they go back the 31st?
Because we've made a decision that there's a statewide calendar, and that's, you know, all the districts wanted a statewide calendar, which I support, so we have, statewide efficiency across the board. So it was going to be the 31st, now we're saying it's the 14th. I don't know where you live, wherever you live is your business. My point is, if it's safe to go back to school, get those kids in school on the 14th.
And the
I've
district
heard
can
of-
decide that. The district can decide
Yeah.
that. It won't be coming from the state.
Yeah, well, we will approve their plan. We've approved their plan and say, yeah, you're good to go. And then they need to get the kids in school.
It seems, Governor, that a lot of the pushback is coming from the teachers and the teachers' unions.
Yeah.
How much is that being taken into consideration? And I know you've already said at some point they have to go back to work.
They do have to go back to work, just like you've had to work. I listen to them. I listen to them. Listen, everybody's afraid. Teachers are afraid. It's legitimate. I understand that. Nurses are afraid. People that work in nursing homes are afraid. When we brought the RIP to bus drivers are afraid. Like, you got to get up your courage to do it. So I'm hearing them, and I'm promising them that we'll have the safety measures in place so that it is safe. But like in your town where you say it's a very low prevalence, then get the kids in school and go back to school and teach the children in person.
On the busing issue, you've mentioned the National Guard and RIPT are involved in trying to help these districts. Could National Guard buses or troops driving buses or RIPTA
Maybe.
buses be put into play here?
Yes,
Is that,
possibly, yeah. We're looking at everything. I don't have an answer, but it's on the table.
is there any other supply of buses to be had? I mean, that's what I've
Not
heard, is that
really.
there's only a certain number of buses,
Exactly.
so.
Every town in America is struggling with this. So as you say, there's not a lot of extra buses right now. So we're trying to, RIPTA buses, extra vans, guard, what you call it, buses or vans. No.
And just one more question on the schools. The Warwick School Committee voted last night
Yeah.
to approach with full remote, and one of the concerns, and you mentioned, was air quality and ventilation in these older schools. What are your thoughts on them taking that action and that being one of the main reasons?
I could not be more disappointed in the vote that they took. They just threw in the towel on those kids, and I think the children of Warwick deserve better. They didn't even submit a plan for in-person learning. You asked about your town. They didn't even do the hard work required to give us a plan for in-person learning. They threw in the towel before they even tried. And we are hearing from parents who are saying, this isn't fair to my children. And you know what? They're right. It isn't fair. Those kids deserve better. And I am so disappointed in that school committee. It was wrong-headed, and it wasn't thoughtful, and they can do better, and I hope they'll rethink it, and I hope they do better. I'm not saying it's easy. Air quality is a factor, no doubt about it. Cleanliness is a factor. Mask wearing is a factor. So get to work and figure out a plan like everyone else is doing. They didn't even give us a plan for in-person learning for the littlest children, for children who have learning differences, for children with IEPs. Come on, do your job and do better.
Could you mention other communities that didn't even submit a plan? Because, I mean, that's a red flag that they have no intention of going back.
I don't know off the top of my head.
Yeah, no, so no, we didn't have that.
They were the only community.
So what they didn't submit, they submitted a plan. They didn't submit a plan for full in-person, just to clarify that.
Yes,
Full in-person. So I think that's the challenge, because we asked all districts to plan for all eventualities, and we've been talking about the necessity of having plans. So that did not happen. So I think that they were thinking about this direction for a while, and it is hard. It's hard. But we have been sharing best practice, and we have been working with districts to try to get them there. And I have to tell you, we get emails from parents that are scared, but from parents that want their kids to go back. We've made it very clear. There are metrics, and we're going to follow the metrics.
What do you want to tell the parents in Warwick, Commissioner?
That we need to do better, that the district needs to do better.
Well, what can
the
they
school
do?
community.
What can the parents
Well, they can reach out to the school community, because I also want to separate. This was the school community that did this. It wasn't the mayor, it wasn't, the superintendent. This was the community vote, and they should reach out to them and express what they want. We have been very clear that parents have options. It's not okay. It's not okay. We should be doing the work up until the day that we go back to school.
Governor, are you
Follow
concerned?
up on
I've
my
heard from some parents at private schools in a couple of instances where they've been requested to supply camping chairs for their kids because they're planning on meeting outdoors in small groups. At the same time, I've heard from parents and even in some cases students in Providence and Central Falls where they aren't even necessarily able to get earbuds or Chromebooks. So are you concerned about a widening disparity in education that may play out here? Is that part of your thinking with trying to get everyone on the same page by September 14th? Or is that acceptable? Hey, look, you go to a private school in a rural location, why not go back, meet outdoors, sit in camping chairs in groups of 7, and if you're at a Providence public school, maybe you're out of luck. Is that acceptable?
You know, let me say this. It's certainly not acceptable. The COVID pandemic has shone a bright light on inequity across our whole system, across the economy, across education, across healthcare, access to healthcare. And everything we're doing is to try to work to level the playing field, come out of the crisis more equal than we went into it. Part of the reason that I have been so strong about my desire to get children back into school is because it's the kids who can least afford to miss a day of school that are going to get the most hurt. Children who, if you are poor, if you're a poor kid of color in, pick your, Providence, Pawtucket, Central Falls, your life's already pretty hard. You've already been hit pretty hard by this crisis. Or Warwick, we're talking about Warwick. And now someone's saying, you don't even get to go to school. You're going to be stuck at home with distance learning. You may or may not have a good computer. You may or may not have access to broadband. Your parents may or may not be able to help you. That kid's going to be behind for life, potentially, which is why I'm so frustrated when folks throw in the towel without doing the hard work. So yes, I do worry about it, and it's why we're trying to make everything a bit more equal. It's a fallacy to say it's equal. A little more equal. We're sending more, state aid is going to places so they can have more money to open up safely. We're doing the health equity zones, which is in communities that are hardest hit, so they can be more equal. We're setting everybody on the same school schedule. There's no question that folks who are wealthier are doing better through this. But I have to do what I can for every public school, for every kid, to get them the best education we can give them, considering what's going on.
One follow-up to that, if I may. In some cases, there are charter schools in the state that are located in Washington County or in Kent County that have, from what I can tell, 35–40% makeup of students that reside in Providence or Central Falls. What's your message to those schools?
We're figuring that out today, in fact. We have a call later, and we are gonna refine our approach to private schools. It's complicated. So luckily, it's Rhode Island, it's small, we can have a pinpointed approach for these schools. So we need another day to figure that out. Because just because the school's in Providence, if it's a private or Catholic school in Providence, most of the kids probably don't live in Providence. So we are trying to, and of course they don't have to follow our calendar. Private schools follow whatever calendar they want. We just want to make sure that they're ready. And so we're going to probably have to go school by school and have the Department of Health approve their plans.
Governor, I have a question here from Homes, Rhode Island. They write that given that distance learning will be an integral part of schools for the foreseeable future, have you reconsidered an eviction moratorium to guarantee that families have access to an education, because children can't learn from home without home?
Yeah, I am reconsidering it. Not so much for distance learning. I'm going to give Congress another week or so and see if they can get together and pass a bill. There seems to be broad support for eviction relief. Even President Trump wrote a memo suggesting that we should do something. So if in a week or two they haven't taken action, I'm going to have to consider something. Because here's the thing. With it's all connected. If the $600 goes away and we have an eviction crisis and I have 1,000, 2,000, 3,000 people who are homeless, that's a real problem. Obviously it's a problem for them because they're homeless. It's a problem because we have a disease which flourishes unless people quarantine. So I'm gonna see what happens in Congress, and then I am reassessing my executive abilities, and also I'll go to the legislature, because we may have an emergency situation if the $600 goes away and I have a lot of people becoming homeless.
Governor, you offered your compliments in a tweet to Kamala Harris and Vice President Biden yesterday. Did you receive any call from the Biden campaign? What was your reaction to that? Did they reach out to you, or what was your personal reaction?
I'm thrilled. I know Senator Harris. I like her. I think she'll be a great running mate. So I'm excited for her. I'm excited for the country. I don't really want to talk politics here, but obviously I'm a supporter of President Biden's, and I'm going to do what I can to help him win.
No call?
I'm sorry.
No
No.
call? No.
Governor, one of the problems nationally has been that teachers are refusing to go back into classroom situations for in-person learning. And there are rumors, at least from the press, that New Jersey, for example, in some municipalities and areas was forced to cave in completely on that and say, well, we've got 30 to 40% of our teachers who won't go back to work. We cannot force them. We can't have in-person learning without teacher cooperation. And I think I pointed out to you a couple of weeks ago, the numbers, as I understand them, are that about 60% of teachers are 40 years of age or older, and about 35% of teachers are 50 years of age or older. And so they're themselves at significantly increased risk from the virus. What is the plan, and what have been your discussions and exchanges, and maybe the commissioner would want to get on this too, with the teachers, the unions, and the possibility that in-person learning may not be possible because the teachers simply will not do it, or enough teachers will not do it?
Yeah, so a few thoughts. First of all, I'd like to thank the teachers' unions in Rhode Island. The experience that you see around the country is not the experience we're having here. By and large, they have been collaborative, trying to help us solve problems. They did ask, to Brian's question, they did ask for a delay. I thought it was reasonable. We're working together. And so I'm hoping that Rhode Island stands out as a place where we can work together to do the right thing for teachers and children. And so far, we are doing that. The second thing is, it's on us to make the environment safe. So yes, there are going to be teachers who are older, who have underlying health conditions. We have to provide accommodations for them so that they can work safely at work, or if absolutely necessary, then they can work from home. But to just say, I'm afraid to go to work, is not a reason to not go to work. You know, if you want to go to work and be paid for working, you have to go to work. So we are working hard to make sure that it's safe for them to go to work. They've asked about testing. That's reasonable. We have to get into a better place on that. You know, mask wearing, cleaning, the whole thing. But a general fear of the virus is not a justifiable reason to not go to work. And I would like to say, like, to tie in all of these questions, a couple weeks ago, maybe even a week ago, the Interscholastic Sports League put out guidelines for kids for sports. I was so impressed with their work. Not unlike the parents who do Little League, or the equivalent of Little League. They have such a can-do attitude. Like, if this is what the rules are, we're going to do plan A. If the rules are different, we got a plan B. If they're different, we got a plan C. They're going to figure it out to get these kids to have sports. That's what we have to do for school. It is very hard. I understand that. We'll figure it out. Whatever the circumstances might be. It won't be perfect. Maybe it'll be hybrid. Maybe the windows will be open. Maybe you'll be in a lawn chair outside. Maybe you have to have your lunch in the parking lot. Maybe it's some partial learning distance and some in school. Just commit yourself to the children, and we'll figure it out. And so today I'm saying I'm giving us all another couple weeks to figure it out.
Are you applying a double standard in effect where you're saying parents can choose, if you're not comfortable, don't send your kids to school, do distance learning, do whatever, and teachers, you're saying, well, you have an obligation, you have a duty to go back into school if that's the decision that's made?
Well, it's a job. So if you want to get paid to do your job, you have to do your job.
Your large gathering task force hotline, you got state police chasing a lot of what seem to be not serious, I don't know if I'd call it frivolous leads, but they're chasing their tail, basically, in a lot of cases. Is this how you want your premier law enforcement agency to be spending its time? They've got limited resources. You got detectives, you got troopers. and these people are chasing, you know, some guy might be upset with his neighbor about something totally unrelated, and this is how you have the state police working day to day.
So first of all, that's a great question. And I'm in a position where we have to try things. And if it works, we keep doing it. If it doesn't work, we stop it. This was actually the colonel's idea, because we've been struggling. And he said, Governor, let me see if I can help out. I will say they are excellent. As you say, they're premier law enforcement folks. They got 400 calls. They investigated 56. So I don't think they're chasing their tail. I think they were following up on credible leads.
They had to answer 400 calls.
Yeah. You
That's
know,
a lot of time to answer 400 calls.
True. If I could think of a better way, I would. You know, municipal police officers are asking for help. We have the guard on it. We're overwhelmed with it. If you have an idea, and I'm not being fresh, I'm serious. Here's what I know. I've got to get the cases down. I don't want to close the economy again. So if my choice is, like, if everybody would social distance and wear masks and not gather, everybody could go back to work and school.
But you're in a situation now where law enforcement's got enough community police relations, and they're, you know, in some communities, not necessarily Rhode Island, and you're basically introducing the police into a situation to pit some people against each other. That's what I've heard from some people. And is that what you want to be doing with law enforcement, given the times nationally and here?
Yeah, so you make a good point. Let me say this. It's not all we're doing. Like just today, just this morning, before I came in here, I convened a meeting of our Latino advisory group, asking for volunteers in the community, social service organizations in the community, community groups to do this. We'll supply them with the masks. We'll even hire folks to go out on weekends. That's clearly better, to have people from the community, in the community, enforcing social distancing and passing out masks. And we're doing a lot of that. But we were getting to a point where we were having a lot of problems with crowds that we weren't able to break up. Like, it required law enforcement. So I thought that there is a role for law enforcement to play if we're going to get serious about this. I can't get up here day after day and say 100 cases, 120 cases, 150 cases. And so we felt that there's a role for law enforcement.
Governor, on that front, we've seen some more pictures and videos from the Block Island Ferry. Have you heard anything more about that, concerns about that? Any
Block
more
Island
steps
is
you're
not doing well. Let me just say this. We need to do better in Block Island. Newport is doing well. Now, why am I saying Block Island and Newport? Because, you know, they have both have a lot of tourists, both have a lot of folks from out of town. The community in Newport, for whatever set of reasons, has really come together. Mask compliance is there, mask wearing in retail is good. We haven't had as many problems in restaurants and bars. We need to get better. We had a big meeting yesterday. We need to put more resources, more inspectors in Block Island, and I might even have to take some action, because it's
Who was that?
I'm sorry?
You said that you had a big meeting yesterday.
Oh, internal, like the Department of Health. We have a community mitigation team with Department of Big Business Regulation, who has inspectors out there. We have folks monitoring the ferry. We need to do something different in Block Island.
Is there something specifically about the ferry that you can do, whether it's putting a state trooper on the ferry or telling the company they need to do better?
You know, they pass out masks on the ferry. Technically, they're for sale for $1, but they're pretty much giving them away. Again, we're trying everything we know how to do.
Where are you getting that information about Newport? Because I've heard and seen just the opposite.
Just from our inspection. First of all, nothing's perfect, okay? But, you know, if we send out inspectors to go look at 20 restaurants here and 20 restaurants there, we look at the data. How many crowds are there congregating in restaurants? What's the percent of customers and employees in retail operations wearing masks? Cases, you know, number of cases, prevalence of cases.
To follow up on
Cam hasn't had a question.
On schools, obviously you expressed your disappointment with Warwick. Does the state have the ability or the intention to override a decision like that, to say, listen, your numbers are okay to go back to school in person, you have to do that? Is that something that might happen?
We are looking, in light of what happened, I am looking into all of the state's options funding options, legal options, et cetera, that the Department of Education has or the state would have. So we're looking into that, and we'll use whatever tools we think are necessary. I'd rather take the approach of, how can we help you get there? Let us, like Warwick is not at 100 cases per 100,000. They could go back. So let's get to the table and figure out how we're going to get as many students as possible back in person. We're going to work on that while I also investigate what levers we have in order to convince them to do the right thing.
So it sounds like
But we can't force them. To answer your question, we can't force them.
But it sounds like maybe legal action is not off the table?
No, I'm investigating the options.
And just a question on the calendar. Is it possible that we'll see the calendar change again? Whether it's another delay in schools reopening, cancellation of spring or winter recess, or,
Given that we live in a world right now where anything is possible, and this virus changes things in the space of a week or two, I would say yes. However, it would take a lot for us to change this calendar. We'd be more likely to go back, distance learning or hybrid than to change the calendar.
Governor, on contact tracing, do we need to hire more contact tracers? And I had a follow-up question about the response rate. Dr. Scott, you said it's gotten worse since the start. Do you have a specific percentage on people who are not responding, and do you have any idea why they're not responding?
She does have that data, and yes, we are hiring more people.
How many do we have, and how many do we need?
Do you want to answer that? We have well over 100. I think we could easily need double that. And we are right now evaluating how many more we need. A lot of states, like Massachusetts, outsources it. They've hired an outside firm, so we're looking, maybe we should do that. Right now, we're very heavily dependent on the National Guard and also the Department of Health, but we have hundreds of people doing this, full-time.
To follow on the contact tracing, months ago, Charlie Baker in Massachusetts was saying, if you get a call from thus and such a number, or it says something on your phone, don't ignore it, it's the contact tracers calling you. We've never done that. I don't believe you've ever done that.
I could do that, yeah.
I don't know if you have a uniform way of contacting people or what. And why do this now? Are people blowing you off when you call?
Yes. So we've seen fewer people picking up the phone. 2 months ago, 90% of the people picked up the phone and gave us the information. Fewer people are picking up the phone now, or if they pick up the phone, they just say no. We're not going to give you the information, which is why today I'm making a plea. If you get the call from the Department of Health, answer the call. If they ask you for contact information of the people you've been with, please comply with us. It's private. We won't share it with anyone. It just allows us to do the contact tracing.
Dr. Alexander Scott, maybe you could also address, we've heard from a lot of people who don't know how to verify that the call is legitimate. They get afraid, they hang up. So I think that's probably what Steve is getting at too. How do they know that it's actually the Department of Health?
Thank you for that. So I want to make sure I cover all of these. What the governor said, and starting with the answer to the challenges we're having with getting the information from people, does stand. It is more now than it was previously. And it's about 10% or so of our cases where we're needing to really work with people to give us that information so that we can support them in keeping the people that they love and have been exposed to safe. We are working to be able to have the technology support having a number in place that makes it clear to people from the caller ID standpoint of who is calling. When our staff are on the phone, we are saying we're calling from the Rhode Island Department of Health. It's important for people to know there is no intention or ask for any information about their bank account or looking to get funding in any way. So if any of those types of requests come through, it's important to know that that is a concern. We say Rhode Island Department of Health.
Their caller ID doesn't say you're getting a call from the Department of Health.
We are working on getting the technology to support that because we know that will be a helpful reassurance for people, but we are verbally saying, I'm calling from the Rhode Island Department of Health, and those individuals will oftentimes have the general information that could help verify that they actually know what they're dealing with in the conversation with you, and you can work with them to get information on what you need to tell your contacts and beyond. And then the last follow-up to the initial question about getting more contact tracers and case investigators, part of that also is in the planning for what we will see with K through 12 and schools. So we want to build up what we need now and be able to forecast what are we going to need so that we can help support making sure that everyone stays safe across the board.
Doctor, what's the protocol if if the Department of Health initiates a contact tracing call? Do you leave a voicemail if somebody doesn't answer? What does that voicemail say? Is there a number people can call back if they're suspicious about the validity of the call? What exactly is the experience for somebody who is contacted as part of contact tracing?
So the experience is if someone is reported to be a positive case in terms of their test results returning positive, someone acknowledges themselves as the Rhode Island Department of Health and calls to inform them of the test result. Helps also in getting information about where they have been. That's how we have the data on whether or not people are going to work sick. Also gets information about where they may have been exposed and gets information about who they have been around and who else needs to be called to be made aware. There's also a tremendous amount of work that goes into where the person works and that work setting so that we can help ensure that their supervisors and those in the work settings have the information they need about how to handle the response there. It's then connected with, in some situations, the contact tracing team that reaches out to each of the contacts to inform them of their exposure. If someone has concerns about whether or not it was a legitimate caller from the Rhode Island Department of Health, you can call us at our hotline number, 222-8022. Say that you received a call and want to be able to verify, was that truly from the Rhode Island Department of Health? Because if it was from us, we really want to make sure that you get that information, that you and your loved ones are able to stay safe and receive the support that's needed going forward.
But the governor specifically said that one of the problems was people not answering the calls. So what I was asking in part was, and I appreciate the answer in detail, but one thing I was asking specifically was if somebody is called by the contact tracing team and does not answer, and there's a voicemail response, do you then leave a voicemail message? Do you ask people to call back? What does the voicemail message say, or do you not leave a voicemail message?
Voicemail messages are left. I don't have the exact script of what is said, but in general, it's just acknowledgement that the Rhode Island Department of Health called and a standard number to be able to call back to get more information. Nothing more is said than that on a voicemail message.
Last question. All right, great. Actually, I have two questions, two-part questions for the governor. The crisis with the nursing homes. You intervened about a week or so ago when the nursing home staffers were going to strike and said your office was going to work with them to raise pay. Where does that stand?
It wasn't about pay, it was about the staffing levels. We are in constant contact with them it's with SEIU, to try to figure out if there's a solution. You know, the legislature declined to pass the minimum staffing bill as it was proposed, so we're trying to see if there's another option that might, you know, a compromise that might be able to get through the legislature.
But nothing at this point.
No, nothing at this point.
And the other part of that question is, I've spoken with a number of families who have talked about the visitation limitations and the real difficulties with that. There are other states who are doing different things with visitation when it comes to Alzheimer's and dementia patients, where they've designated perhaps one caregiver who can be the person who goes in and spends time in the nursing homes working with their loved ones, because they generally do the same work that the staff does. Is the State Department of Health or your office looking at changing anything with the restrictions to allow more access to the patients?
I'm going to let the doctor answer that because they're making all those calls. I will just say that I know this is really hard. I hear a lot from a lot of folks. I've had friends whose loved ones have died in the nursing homes and they haven't been able to see them. There's no closure. So we're not deaf to the concern, and I think it's very real, but I'll let you answer.
Yeah, and to that point, we are absolutely open to considerations that will work both for the family and for the nursing home with a focus on keeping people safe. We've taken the last few weeks to get people adjusted to the rhythm of visitation and how to respond if there are cases, and have the full intention of continuing to develop that in a way that is most supportive, particularly for the residents that are at highest risk.